to enhance and have a healthier living, healthier lifestyle. So what is diabetes? It's a group of metabolic diseases in which there are high blood sugar levels over a long period of time. What happens in diabetes is either your body is producing too much sugar, your pancreas is not producing enough insulin, or your pancreas is producing enough insulin and your body's not using it correctly. So diabetes has many serious long-term complications, including heart disease, stroke, kidney failure, foot ulcers, damaged eyes, vision, just to name a few of those things. Diabetes can affect any nerve in the body, which is why it's so serious, but it can be managed appropriately if someone is armed with knowledge and is diligent with their care. So there are three main types of diabetes. There's type 1, which we used to call juvenile onset diabetes, but now they're seeing it more in young adults. It's basically if you're type 1 diabetic, you are dependent upon insulin. There's no other treatment that you can take to substitute for insulin. You may take medications in addition to that, but in type 1 diabetes, your body's producing no insulin. So you have to supplement with insulin at least 5 to 6 times a day. In type 2 diabetes, that's what we most commonly hear about in people that when they get older to middle age to older, and you can treat type 2 diabetes with a combination of medications, insulin, or just diet and exercise, depending on how well you can manage it. And then gestational diabetes is a type of diabetes that develops in pregnant women. Most of the time it goes away, but you are at higher risk for developing type 2 diabetes later if you have gestational diabetes. Okay, so some risk factors for developing diabetes. Family history, of course. If you have a direct family history, be it mother, father, siblings, children, you're at higher risk for developing diabetes. Race is a huge one. It disproportionately affects African Americans. We're 60% more likely to be diagnosed than white Americans. Twice as likely to die from diabetes as white Americans. 2.5 times more likely to be hospitalized and have associated long-term complications, and 3 times more likely to develop end-stage renal disease. Obesity is a risk factor for diabetes, which we'll get into a little bit later. Immobility and lack of exercise, and of course, having a poor diet, which leads to obesity. Signs and symptoms. So we used to have people come into the diabetic clinic all the time and say, you know, I was getting up all night, going to the bathroom, and I was really, really thirsty and really, really hungry, and I didn't exactly know what was going on. Those are all signs of high blood sugars. So frequent urination, increased thirst, increased hunger, unexplained weight loss. So you're eating all the time and still losing weight. Poorly healing skin or dry skin, extreme fatigue or tiredness, blurred vision, an increase in irritability, increase in infections such as gum, skin, or vaginal infections, and ketones in the urine. So there are other things that can be caused by, there are other reasons why you might have frequent urination. You know, you may have a urinary tract infection, increased thirst, you may just be dehydrated. But if you notice this is kind of persisting and it's different for you, and you haven't had your sugar or your A1C checked in a while, it's good to do that. Okay. So like I was just saying about the A1C, diabetes is diagnosed with an A1C above 6.5. What the A1C is it's a range of how your sugar has been running over the last 2 to 3 months. So I can check my blood sugar right now, but if I just ate something sweet, it may be high. That doesn't necessarily mean that I'm a diabetic. So the A1C is a number that tells you what your sugar has been running over a period of time if it's consistently running high. So pre-diabetes is 5.7 to 6.4. And I actually got my A1C checked the other day and I was at 5.7. I almost had a heart attack. But it's good to know that I'm getting into those numbers, and I know I had high risk for it, being African American, obesity, not having the best diet, those kinds of things that a lot of people are concerned with, plus family history. It's on both sides of my family. So, but there are things that we can do to get it turned around. Fasting glucose above 126 on 2 separate tests. So when I say fasting glucose, I mean if you've gone 6 to 8 hours without eating. If your blood sugar is over 126 on 2 separate tests with a fasting glucose, then that means that you could potentially be diagnosed as having type 2 diabetes. Anytime you take a random blood sugar that's greater than 200, A blood sugar over 200 is not normal for anybody anytime. Okay. And then the glucose tolerance test reading of greater than 200 after 2 hours. There are lots of treatment options. I'm not going to get into all those. But there's metformin that a lot of doctors will start people off with. And then it has on here the mechanism of action, the side effects. A lot of people with metformin have GI, we call gastrointestinal side effects. So they may have upset stomach, diarrhea, nausea, those kinds of things. And then the contraindications that I have, and I'll make this PowerPoint available to anyone that wants it. The contraindications that I have, or people with these particular conditions do not need to take these medications. Okay. So where it has metformin, contraindications, if you have CKD, which is chronic kidney disease, heart disease, liver disease, or metabolic acidosis, metformin is not a good drug for you to take. Okay. So going on down this list, you have pioglitazone, that's commonly known as Jardiance, if anyone's ever heard of that. There's a contraindications for that. Glipizide is an older drug that a lot of people use, but it has a high risk for hypoglycemia, which is when your blood sugar drops too low. And if you have any trouble with your liver or your kidneys, it's not good to take. Dapagliflozin, which is Farxiga, if anyone's heard of that. Renal impairment, if you have any issues with your kidneys, you cannot take Farxiga. So a lot of times doctors will prescribe medications for people and they don't have your complete history. So that's why it's important to make sure that you know what medicines that you're taking and what your history is. And then getting down here to the bottom with insulin. Of course, a lot of people with diabetes end up having to supplement with insulin. Even if they take some of these medications, they may have to take insulin as well to bring their blood sugars down. I know I work at a nursing home and we have patients that have to take insulin before meals, after meals, or at night, in the morning. It just kind of depends on what regimen works best for them. But we'll talk about insulin on down in the PowerPoint as well. Okay, so does diabetes ever go away? That's a question that we used to always get asked. The short answer is no. You can be a controlled diabetic or an uncontrolled diabetic. A controlled diabetic means you get your A1C numbers within normal levels. But we never want to say that it's cured, because what tends to happen is people will say, oh, I don't have to worry about taking my diabetic medication anymore. I don't have to worry about managing my diet. And then next thing you know, the numbers have creeped slowly back up. So you always have to live your life as a diabetic once you've been diagnosed with diabetes. But there are lots of ways you can do that and still enjoy what you eat and enjoy your life as well. All right, so just talking about some complications related to diabetes. One of the number one complications is coronary artery disease. It can damage your heart, and coronary artery disease is the leading cause of death in this country. It can damage nerves in your brain, potentially leading to stroke. Oral health, tooth decay and cavities. A lot of people are unaware how important your oral health is to your overall health, because there have been cases of people who developed an abscess and the abscess went straight down to their heart and caused endocarditis. So taking care of your teeth is vital. People don't think about how important it is. And it kind of bothers me that like people with Medicare coverage and stuff like that, they don't cover a lot of things related to oral health. But taking care of your teeth is super important. Neuropathy. Anybody have heard of somebody saying they feel like they have pins and needles in their feet? That's what that is. It's neuropathy. And a lot of times that's related to diabetes as well, but you can have neuropathy without having diabetes. End-stage renal disease. That's what we talked about, your diabetes affecting your kidneys, leading to potential dialysis. Loss of limb, sexual dysfunction. And I think I left out on here your eyes. I can remember being a young girl and having older people in my family that couldn't see or might have lost some toes or something like that. And I didn't really know what the reason was. But now looking back, I know that most likely it was related to diabetes.
Hold on just 1 minute, Dr. Wilkes. Somebody has their device unmuted. Can we get everybody to mute? Thank you. I'm sorry. Go ahead, Dr. Wilkes.
So what can you do to prevent diabetes? Get active and eat right. Those are the main two things you can do. And if you smoke, stop smoking. Grab a circle of friends to exercise with. It's so funny. I showed this PowerPoint to one of my friends today, and she was like, but y'all won't come exercise with me. Grab a circle of friends to come exercise with, okay? Lose weight. Make sure your weight is in a healthy range. Get screened. If you're not diabetic, you should be screened at least once a year if you're over the age of 30. Be screened at least once a year to make sure that your A1C levels are normal.
So this is, I'm sorry to interrupt you. So this is like with your mammograms, get them once a year. Right. You need to be screened at least once a year.
Right. And you need an A1C at least once a year. And if you ever fall into the pre-diabetes or diabetes range, then you need to have your A1C done every 3 months.
Ooh, okay. Thank you.
Okay.
Go ahead.
You want to eat more fruits and vegetables, limit red meat, and skip sugary drinks.
Oh, Lord.
Sugary drinks is like the biggest thing that we used to preach at the diabetes center, because like a Coke or a Sprite or a fruit punch, you would just be amazed. Like the number of carbs that's in one 20-ounce Coke is probably more than you need to have for the whole day. Ooh, wow. But we'll talk about the carb content and everything as well. So the ABCs of diabetes management: you want to watch your A1C, which we talked about. Watch your alcohol intake. You want to limit that to no more than 1 drink a day, and 1 drink a day at the max is like a glass of red wine, maybe. You want to watch your body weight, your blood pressure, keep that within normal limits. Carb control, your cholesterol, keep your doctor and your dentist appointments. Make sure that you are keeping up with those. Go ahead,
Cassie. All right, bye-bye.
Okay. Make sure you keep up with your doctor and your dentist appointment. And then, of course, stop smoking. All right, so here are your blood sugar and blood pressure goals. So for a fasting glucose of someone who's diabetic, it should be between 80 and 130. For someone who's not diabetic, it should be between 70 and 110. Post-meal glucose, and this is important too. A lot of people will eat and then check their blood sugar. That's not an accurate reading. You have to wait at least 2 hours after a meal before you check your blood sugar for it to be accurate as far as whether or not it's too high or too low. So post-meal glucose should be less than 180 in people with diabetes and less than 140 in people who don't have diabetes. Now, of course, if you're diabetic, anytime you feel strange, you can check your blood sugar. But what I'm saying is people will eat a huge meal and then check their blood sugar and panic because it's high. It still has to have time to come down to those normal levels. Your blood pressure should be less than 140 systolically, 140 on the top, 90 on the bottom. And make sure that you are moving. Keep yourself active if at all possible. All right, so let's do some fact versus fiction. Y'all tell me if y'all think this is right. Increased sugar makes you have diabetes. What y'all think?
I think it can lead to it.
Definitely. It can lead to it. Now, just the intake of the sugar itself doesn't necessarily make you have diabetes, but sugar intake leads to obesity, which in turn leads to diabetes. Okay? Thin people can't get diabetes.
Fiction.
Fiction.
Definitely. Pre-diabetes always leads to diabetes. Wow. That's fiction as well. Just because you're pre-diabetic doesn't mean you're always going to be diabetic. You can get control of it and stay within that pre-diabetes range or get below that pre-diabetes range. Of course, I think we all know you can't catch diabetes. People with diabetes can have healthy babies all the time. A lot of people spread the knowledge that if you're diabetic, you shouldn't get pregnant. You definitely can get pregnant. You definitely can have a healthy baby, but it all depends on how well you manage yourself as well. If your parents had it, so will you. Y'all think that's true or false?
False.
That's false. You're at a higher risk, but it's not a definitive that you're going to have it just because your parents did. Diabetics have to follow a strict no sugar diet. That's false. Everything in moderation. And then eventually diabetics will lose their sight or need dialysis. That's also false. It all depends on how well you manage. So hypoglycemia with diabetes can also be dangerous. Just like your blood sugar can get too high, it can get too low. So if your blood sugar drops below those levels that we talked about earlier in the PowerPoint, there's a rule of 15. You want to treat with 15 grams of glucose and recheck your sugar in 15 minutes. So 15 grams of glucose is going to be glucose tablets that you can buy at the store. Anybody who takes insulin needs to keep glucose tablets on them at all times. Or 4 ounces or half a cup of juice or regular soda. This is one time when we say it's okay to have regular soda. If the person is unconscious and their blood sugar is low, if there's anyone else there, they need to call 911 immediately. And if you're taking insulin, you want to always have food ready to eat. We used to have instances of people who would take their insulin, then go warm up a plate and they pass out before they get the plate out of the microwave. So make sure you have your food ready to eat if you're taking your insulin with meals. All right, the My Plate method is something that we taught at the Diabetes and Nutrition Center, and it's just a good diet for anyone to follow. So you take your plate, an 8 or 9 inch plate, you divide it in half. 1 full half of your plate should be non-starchy vegetables. The other half, you take that and divide it in half. 1/4 of your plate should be your carbohydrates. The other quarter of your plate should be your protein, your lean meat. So that's your chicken, turkey, fish, anything that's baked, broiled, or grilled. That's a good diet for anybody to follow to maintain within carb control. Here's a list of non-starchy vegetables. A lot of these things on this list are going to be considered like free foods. Any green vegetables, you pretty much can eat as much as you want without worrying about going over your carbs, except for sweet peas. Okay. There's a diagram with low carb veggies. So if anybody likes, and there's something on here that's not on here, it's turnip greens, collard greens, mustard greens, anything like that is going to be low carb, and they're in order of their carb content. So green beans have the highest number of carbs, but still very low. Kale is one that's like a 0 carb food almost. Cucumbers, spinach, mushrooms, celery, any of those things you can pretty much, this is what you want to fill up on instead of filling up on your carbs. Okay, so how many carbs per meal per day? That is highly individualized based on how much someone exercises. A general rule of thumb is about 45 per meal for women and 60 per meal for men. So 1 serving of carb equals 15 grams. So let's just say, if I were looking at this diagram on the side, 1 slice of bread is 15 grams of carbohydrates. If I can have 45 grams as a female per meal, that means I can take a sandwich, which will be 2 slices of bread, and you always want to utilize wheat, brown rice, wheat pasta. Those things take longer to convert into sugar in your body, and the fiber content is higher than in those white things. So let's just say I want to have a sandwich with lettuce, cheese, tomatoes, and turkey, and then I want to have an apple. I would still be within my 45 carbs for that particular meal. Does that make sense?
Yes.
Okay. All right, there are more 15-gram carb foods to make it easy for you to count with your meals. Just the biggest thing, like I said, if you don't want to count carbs, is utilize the My Plate method. Just make sure that half your plate is green vegetables. There's a sample diabetic meal plan. Okay, so getting into relationship between diabetes and cancer. A lot of people, for a while, we didn't know that there was a significant relationship between diabetes mellitus and cancer, and a lot of it has to do with the risk factors. So the risk factors are going to be the same for both of these disorders, which is obesity, poor diet, lack of exercise, etc. But there's also a genetic factor, a genetic component. Untreated hyperglycemia may facilitate tumor growth. So what that's saying is diabetics have a higher risk for certain types of cancers, liver and pancreatic cancer being the top 2. And that's because your liver is what produces sugar and your pancreas is what produces insulin. So when your pancreas is damaged or is trying to overproduce insulin and your body's not using it correctly, or your liver is producing too much sugar, that places you at a higher risk to develop an overgrowth of DNA, which is what cancer is, essentially just an overgrowth of DNA. Long-standing diabetes increases your risk of pancreatic cancer threefold. Chronic inflammation, which is what a lot of people with diabetes suffer from, also increases your cancer risk. Because once again, all cancer is an overgrowth of DNA that creates a tumor. Okay. What role does metformin play? So metformin is a controversial drug. It used to be the first line that we prescribed for anybody with diabetes, but then we started realizing that it was not good for people with kidney problems, that it could potentially damage your kidneys. Now, they have found that people that are on metformin that don't have any problems, that end up developing cancer, metformin has a protective mechanism to help increase their outcomes of being positive with their radiation or chemotherapy treatment. So it's kind of controversial. I tried to find the most up-to-date articles, and it's still not set in stone as to whether or not it's significant. So we talked about liver and pancreatic cancer. These are in order of what cancer diabetes places you at risk for. Liver cancer being number one, then pancreatic. Endometrium, colorectal or colon cancer, bladder cancer, lymphoma, breast cancer, and prostate cancer. So what causes cancer in the first place? The top two overwhelming factors are tobacco and obesity. And obesity is such a huge factor because if you have an abundance of growth cells, your body produces more growth hormone, which in turn produces more DNA for those cells. Okay, so if you have your body at a healthy weight where your body fat is lower, then it's not going to have an overproduction of those cells. Occupational factors, so if you work somewhere with dust, mold, etc., that can place you at higher risk. Family history, of course, if you have someone in your family that's been diagnosed with, let's just say, breast cancer, if your mother or your mother's mother was diagnosed with breast cancer, then you're at a potentially higher risk to develop breast cancer. Viruses or biologic agents like Agent Orange, if y'all have heard of that. Perinatal factors. So if your mother smoked when she was pregnant with you, if she drank when she was pregnant with you, even things like older maternal age places a child at risk for developing cancer. And they're not sure what the connection is with that. But a very low birth weight or a very high birth weight, mothers who are diabetic when they're pregnant, or mothers who have high blood pressure when they're pregnant, those children later on down the road are at higher risk for developing cancer. Reproductive factors. So too much estrogen sometimes can place a person at risk for those reproductive type cancers. That's going to be, your breast, ovaries, cervix, those kind of things. Alcohol intake, and then other things like radiation, pollution, salt and food additives, socioeconomic status make up less than 5% each. Okay, so now what? Now that we've talked about diabetes and how to manage it, it's extremely manageable. It just takes willpower. Remember, you're not alone. It doesn't have to be perfect. It's never going to be perfect. You can still celebrate. We used to have people come in. We had a lady who come in one time and she was like, it was her 80th birthday party and she didn't want to eat any cake. Girl, eat that cake. And then you start over tomorrow. Okay? If you fall off occasionally, just get back up. Everybody's going to fall. And you have to set reasonable goals for yourself. If you don't exercise, it's not reasonable to say you're going to start running 5 miles every day. Set you a small goal of 15 minutes, 3 days a week, and then increase it. Make sure you make time for self-care. A lot of people who are caregivers or who are busy, parents, taking care of parents, busy with work, busy with all these things, we lose ourselves in the process of doing all these things for other people. And then we don't pay close attention to things that are happening to our bodies and take care of ourselves, which is so important. I was talking about setting achievable goals for yourself. Listen to trusted professionals. A lot of people are going to have a lot of advice. But you want to make sure you listen to a trusted professional. Okay? You control your health and you can do it. Now, get busy living. Or what they said in Shawshank Redemption, get busy living or get busy dying. All right. Thank you very much.
Dr. Wilkes, we appreciate this information. If you all could view my face, I love a sandwich. I'm trying to get into this wheat, but I think I'm just gonna start eating more spinach and green because my heart's over here beating now. It's like, oh Lord, if she checked my blood pressure, she'd probably get on to me right about now. Oh, that was so much information.
And if anybody wants any of that information, let me know. I'll be glad to share it with you. If you have any questions, I'm gonna make sure y'all have my cell phone number, email address, however you want to reach out to.
So while you're at that, go ahead and give us your contact information because this video will it's being recorded. We're going to put it on our YouTube channel as well, and it's on Facebook Live as well. So if somebody out there wants your information, how can we get in contact with you?
You can call me directly. My cell phone number is common knowledge just about everybody. 706-590-5705. You can reach me through Facebook. My name is Nakesha Wilkes on Facebook. You can email me at hillnak@hotmail.com.
Okay. I hope y'all was writing that information down. If you have to go back and replay this video, that is all right, because she has given us this information, how to contact her. One thing she said, we must listen to the trusted professionals. I trust her because she gave her credentials at the beginning. There are some who just joined us. And tonight we're talking with Dr. Nakesha Wilkes. It's National Diabetes Awareness Month. And Dr. Wilkes, just one more time, give us your credentials, just tell us just a little bit why you're sitting behind the desk and informing us about diabetes.
Okay, so I've worked in so many different areas. I have a bachelor's in nursing from Auburn University. I've been a nurse since 2007, a registered nurse since 2007. I have been a family nurse practitioner with a master's from Troy since 2015. And I have a doctorate of nursing practice from Troy University that I got in 2022. I actually am a faculty member at Tuskegee University. I teach nursing classes to undergraduate nursing students. I've worked in a diabetes and nutrition center as a diabetes educator. I've worked in women's health. I've worked in not endocrinology, gastrointestinology. I work in a nursing home right now. I work in hospice, I work in palliative care. As you can see, I believe in moving around. Keeping busy.
Keeping busy so she can keep us informed, because we all have our elderly loved ones. We have to take care of us as well. And we have our children, our nieces and nephews that are coming along behind us. So she's giving us information for all ages tonight. If you missed the beginning of this webinar, you are more than welcome to go at your leisure. It will be on our social media page, as if you're watching now. If you're watching via Zoom and you missed something and you want to write it down, we did record it. It will be on our YouTube channel. All you have to do is search on YouTube is Team Whip Alabama, and you will find it there. Does anybody have any questions? I'm going to read a comment. If I'm saying the name right, Prathan Sandy Powell, she said it was great information. Charlie Red said, I love the way you described the link between diabetes and cancer. I did too, because, you know, I promise y'all, these things that just be popping up in my head, they're just not popping up. God is telling me, hey, you need to contact this person because the people need to know. And I said, is it the people or is it me? And yeah, it's you too, nah. So I need to know this information as well. And I don't want to withhold it from anybody else. That's how we can decrease the disparities. That's the beginning of decreasing the disparities. It's not all in the healthcare system. We've got to have knowledge up here as well. Are there
be armed,
ma'am?
I said you got to be armed to take care of yourself and be your own advocate.
Right. You have to, and that's something we talk about in well, that's our third point in Team Whip. We talk about prevention, early detection, advocacy, and then survivorship. And that's across the board. It's just not for breast cancer survivors. That is for anybody who is living, breathing, and moving. Are there any questions from anybody tonight for Dr. Wilkes? I know some of y'all may wait. I'm just gonna wait and I'm gonna call her later because they want to come. Matter of fact, if they want to make an appointment with you, that's what you need to do. Okay, I think my classmate, she says that was an awesome job. Yes, it was. And I appreciate you inviting your entire crew on here, girl. My phone buzz, and I was like,
I gotta acknowledge all my folks. They always show up and show out. I'm looking at them right now. They show up and show out.
So now what we're going to get in, Miss Kalitha Reynolds.
Hello, everyone.
Hello. I am going to briefly, I saw a post you made. Oh, my clock is I got to go off. Okay, now. And it's just funny. All of this just came at once. I'm talking with Dr. Wilkes, and then I see your post, and your post says, enhance diabetes plan. And I was like, God, look at you. You just laying this in the lap, just laying in the lap. So, Miss Kalitha Reynolds, I'm going to let you briefly tell a little bit about your background and what brought you to this point of where you are now in your journey.
Okay. Hello, everyone. My name is Kalitha Reynolds. I'm a married mother of 4 daughters. I graduated from Auburn University in 2002 with the management, bachelor's in textile management and technology degree. And I spent about 20 years in the quality management field. And so around 2017, 2018, I got into the insurance industry. I started out with life insurance, and it just pierced my heart. It became a passion of mine to not only just sell a product, but to make sure that we are offering products and educating our community. And when I say our community, mostly people who look like myself and my family members, to make sure that we're just not selling products, that we're making sure that the products that our community have benefit them and that they understand the benefits of the product that they have. So, God laid it on my heart to, after 20 years of working in quality management systems, anything, anywhere from management. Finances, budgeting, lab, project management, all of those things that you could think of about being a manager, leading teams of over 35 people. In 2000, God pierced my heart. I had been praying for a purpose-filled life, and he pierced my heart to say, after 20 years, it's time for you to step out on faith and begin your journey of purpose, to begin your journey of educating your community and making sure that you are someone in your community that's bringing a benefit to your community. So we launched the Reach Agency in 2000, and what is this, 2024? In 2023. We launched the Reach Agency. So our agency is an independent, locally owned agency. We offer products from many different carriers. We offer life insurance, health insurance, auto insurance, homeowners insurance, renters insurance, business insurance. We offer bonds, surety bonds, and we also offer tax preparation services. And I live in LaGrange, Georgia. The agency is located in West Point, Georgia, and I'm from Lafayette, Alabama. That's my hometown.
Okay. So tell us tonight, we've heard about the myths about diabetes. We've heard how we can maintain it. And it's manageable. And we've also heard about that, hey, we still got to live. Mm-hmm. So with all of this, how beneficial is it for us to have insurance? Because it seems like a lot that she listed and talked about, we have to have the trust in our professionals. So that means we have to go see them. So how beneficial is it for us to have insurance?
Are you specifically talking about health insurance? How beneficial is it, or just insurance in general?
Well, health insurance.
Okay.
And then, and after the health insurance, tell us about how the benefits of the diabetic plans that are now available.
Okay. So if you don't mind, Nafunda, I'll share my slides that I have just so I won't get off tangent and stay within my talking points. Okay, it's disabled. Okay.
Okay, I think I made you co-host.
Okay. So can you see my screen? Can you all see my screen?
Yes.
That's not the screen I'm trying to get to the. Sorry. Okay. So I'm just going to advance on to advance this screen. I'm not going to do all of these things about myself, but I do want to get over to understanding the importance of healthcare and just understanding affordable plans, healthcare plans. Okay. So one thing that we need to understand is that the Affordable Health Care Act is a comprehensive healthcare plan reform, right? That was passed by President Obama when he was president of the United States. And it gave the opportunity for people who were I guess low income people to be able to afford health care. So we have a government who has made sure that not only that the people who are in the private market have insurance or have access to insurance, but that everyone has access to insurance. And that's part of the Affordable Health Care Plan. Okay. I'm going backwards instead of forward. I'm sorry, y'all. So a couple of things that you need to understand: if you are in the private market, right? So if you have healthcare insurance through your employer, some of those plans might be limited to what the employer offer. Those are considered group plans. But when you are seeking for individual or family plans through the marketplace, through some affordable health care plan, there are ways for you to afford health care. For those of us who know people in our community who have low income or may feel like they can't afford insurance, there are ways that you can afford health insurance. So Nafunda asked how important it is for you to have health insurance. It's very important for you to have health insurance because when you go to see a doctor, you want to make sure that you're able to afford that. You're not going to get all of your care from the emergency room. You get sick, you go to the emergency room, they're going to put a Band-Aid on you, but you need to go see physicians, you need to go see specialists, you need to make sure that you are covered with health care. Many private physicians, healthcare providers will not see you without insurance of some sort. You can't just always walk into someone's office and be seen. So you want to make sure you're taking advantage of the premium tax credits and cost sharing reductions. Okay. So there are ways for you to afford healthcare insurance. The premium tax credit is a tax credit that you can use to lower your monthly insurance payment. That's basically what the premium tax credit is. The advanced premium tax credit allows you to take advantage of low monthly health insurance, and it's an advanced payment of your premium. So it gives you an advanced payment so that it supplements your income to make sure that you're able to afford a proper healthcare plan. So there are ways for you to save money, or there are ways for you to afford healthcare. So depending on your income, you might qualify for one of these cost saving measures. Okay, the Affordable Health Care Plan, you can go to your marketplace to look up plans at healthcare.gov. You can come see me at the Reach Agency. I don't mind helping you. I would love to help you with your healthcare plan. But specifically, we want to get into these diabetes benefits. Okay, so there are plans available to you that, number one, offer $0 diabetes benefits. So one of the providers that I write insurance with is Cigna Healthcare. Okay, and you can ask these questions of any healthcare provider that you may have. They are offer $0 diabetes management education, $0 for certain labs, certain exams, $0 for covered diabetes supplies or prescription drugs. Just make sure that whatever plan you select, whatever provider you have, if you're concerned about diabetes care, ask what your provider offer. You can ask that question of any of your providers. If I'm your agent and I'm working with you on your health care plan specifically, you can ask me. But whoever you sit down with your health care plan, whether it's with diabetes, whether you're concerned about any type of illness, just understand your plan. Don't just buy a product. Don't always just select what seems easy, but select the plan based on your needs. There are plans that offer high deductibles for people who are fairly healthy and don't see the doctor very much. And there are plans that offer low deductibles for people who, are often seen, often having to go to a doctor. So you just want to make sure that you're selecting the plan that's best for you. All plans don't fit, every plan don't fit all people. I beg of you or plead of you to make sure that when you're making these selections that you ask the proper questions. That is what your agent is for. That is, even at your employer, that is what your HR personnel is for you to ask the right questions to make sure that you're receiving the right product, whether it's life insurance, whether it's health insurance, auto insurance, homeowners insurance. Make sure you're selecting a product that benefits you most. For instance, if you're a person that gets sick a lot and you have to go to the doctor a lot and you select a high deductible healthcare plan, what that means is that your insurance will not pay anything until you meet the deductible on that insurance. There are plans that have deductibles all the way up. I mean, I've seen some up to $5,000 deductible per year. And just think about your income. And if you go to the doctor very frequently, just think about your out-of-pocket cost. How much money will you have to pay out of pocket before your insurance will pay? So some low deductible plans might cost more, but in the long run, you save money because you're not having to pay all of that money out of pocket. Ask your healthcare plan provider about enhanced diabetes care plans. Okay, so Cigna Health Insurance and several other health insurance offer these enhanced diabetes care plans. They offer $0 for preferred insulin and other diabetes medications, $0 for diabetic supplies such as it's a lot of diabetic supplies, and I tried to narrow this down, Nafunda, because I know I didn't have very much time, but I don't mind sharing the the entire summary of what this plan offer. $0 for diabetes related equipment and $0 for additional plan benefits. So if you are someone that is concerned about diabetes, and you would like to talk more with me about the diabetes plans or enhanced diabetes plans, you may reach me at the Reach Agency. I'm not hard to find. I'm available wherever my customer need me to be, by appointment, by telephone, by Zoom, office visits as well. As I stated before, I'm located downtown West Point. That's where my office is located. But as of Saturday, my office was inside of Starbucks. And what I mean by that is that wherever you need me to be, I don't mind doing that. I have sat down with families, talked with them about their life insurance plans. We have talked about what's beneficial for their healthcare plan. I heard the young lady a few minutes ago speak about the dental plans and how dental hygiene can play a part in your heart health and I guess your diabetes health care. So we have dental plans to fit everyone's budget. We have dental plans that as low as I saw, this is people who are above the income limit for the supplements, right? So I saw some that was as low as $18, $17 a month that offers $0 preventive health dental plans, meaning you go to the doctor, get your cleaning, at least you get your oral exam, you have a dentist that's looking at your oral health, and then you go, all the way up to your orthodontics care, any type of dental care that you might need. So the plans are very affordable, and with the Affordable Health Care Act, health insurance, dental insurance It's very affordable to all people. Everybody don't qualify for the advanced premium tax credit. It just depends on your income. And just know that if you take that tax credit to supplement your insurance premium, it's going to go by the insurance that you report on the application. However, when you file your taxes at the beginning of the year, the income that you report on your taxes, if it's more than what you stated or predicted on your healthcare plan application, then you could be responsible for paying some of that tax premium credit back or all of it. Or if you overstated your income, you could receive a credit in your income tax. So just make sure that you are informed and that you're talking to someone who wants to help you make the best decision for yourself and your family.
So this sounds like we may need to do another session just with you, with those who, with the insurance, the affordable health care plan. There was a question, do you have life insurance for people 63 and 67? And I'm glad they asked that question because it was very hard. We were trying to get my mother some insurance. She was she was right at 80. So we had some, the premium was kind of high, and then some like, no, she's at risk. So it was hard trying to get her some insurance. But the question is, do you have life insurance for those who are 63 plus years old?
Yes, we do. We do have life insurance. We have life insurance products. And when we get into this, we have life insurance products that fit most scenarios. Okay. Now, life insurance is a little different from healthcare. The Affordable Health Care Act put into place that you couldn't be discriminated against, or you could not, you can receive healthcare insurance even if you have a pre-existing condition. So that's with healthcare. Life insurance is different, right? There are some life insurance products that will approve you with pre-existing conditions. There are life insurance products that are specifically for seniors. There are life insurance products that, I mean, you just have a wide range. And thing about the REACH agency is we have that wide range of product available to you. But when we do start talking about our seniors and when we do start talking about insurance, my goal is to make sure that not only that, I mean, I can sell a life insurance product any day, but how does that life insurance product benefit you? So Nafonda, you was talking about sometime when people are selecting life insurance products, they are very super expensive, very expensive. Mm-hmm. And what I always talk with my seniors or someone who have pre-existing conditions about, when we start looking at that premium, can you truly afford that premium? Because if you can't afford that premium, even though you might be in a situation where you feel like I'm desperate for insurance and I'll pay whatever, if you truly can't afford that insurance, what happens is you end up losing it, right? So does it make sense? Does it make sense? Sometimes, depending on the cost of that insurance, it might not make sense for you. There are other options that you can have. You can have burial policies that just take care of your burial. You can have living. I'm getting my words twisted, but you can have products that benefit you just for your burial. You can have products that benefit you your whole life. There's a whole life product. You can have term life products that just insure you for a period of time. But what I want our community to understand is that life insurance is not the only way for you to bury yourself, right? There are people who don't qualify for insurance, or there are people who have, we have plans that are very expensive, too high for them to afford. Look at your assets. Look at your assets, your home, the things that you've accumulated over a period of time. Make sure that those things are set up in a way that your family can take care of your burial or in the event that something happens to you. There are also what they call pre-burial need plans that you can go to a funeral home, pre-arrange your burial, pay for your burial in advance while you're living. And sometimes that's more beneficial to our family members than an insurance policy. But the main thing is that we have a wide range of products to benefit most people. There are times when you are denied based on based on what you have going on, but we seek to make sure that we can offer some product to everyone. And when we can't, we also want to make sure that we're helping direct you in the right direction to make sure that you're taking care of that pressing need of making sure that your burial is taken care of.
Question. So there are enhanced diabetic plans, and Dr. Wilkes was talking about us taking care of our teeth. And I heard you hit on that just a little bit. What about dental?
Mm-hmm. So dental insurance is very affordable, and I say that with a grain of salt. I mean, I say that it's very affordable. It just depends on the plans that you select. Most preventive care plans are super inexpensive, below $20 a month. And when I say preventive health plans, it gets you into a dentist office. It allows you to get those dental exams, the cleanings that you need. You can go all the way up to plans that allow you to have about $3,500 in coverage, depending on what you need. We have vision plans. We have hearing plans. So those are the dental plans sometimes are paired with your vision and your hearing plans, right? And I spoke with a young person the other day and I said, myself, when I choose my vision plan, I choose mine every other year. I don't carry vision plans every year. If we've all had our eye exams, we know where we stand. The next year, I might not sign up for vision plans. You can get very creative when it comes to being able to afford things. You don't have to carry everything. If you're a fairly healthy person and you don't have a whole lot of health issues, you can decide to choose a plan that's more budget friendly than a plan that costs you more. But there are a lot of dental plans that are very, very affordable. Yeah. And another thing about diabetes, this is another thing. Uh, I've seen a lot of people get approved with life insurance that have diabetes and some who have had cancers, right? And I will tell you what most insurance companies look for is how you are maintaining that diagnosis. So if you were diagnosed with diabetes, right?
Mm-hmm.
But you have not followed up with your doctor. They don't have any other A1C readings. We don't know how well you're managing it. Sometimes it's not that you're being denied just because you have diabetes. Sometimes it's because you haven't been managing your diabetes, or there's not a history of how you are managing your diabetes. So not going to the doctor, not going to your doctor's appointment, not getting your blood work, not having a history of managing and maintain your health could cause you to be denied health insurance. If you got diagnosed with something or a doctor prescribe you to go have some test because they suspect cancer or some illness and you didn't follow up, that leaves a wide open questions to the insurance providers to say, hey, what about that? The doctor referred you to a neurologist. Did you follow up? What was the diagnosis? What was the follow-up care? If you had cancer, okay, how long has it been? What is the prognosis? All of those things take into account. Another thing that's very important for us to understand is that when we go to the doctor and the doctors are diagnosing us or writing things down in our my chart, look over what your doctor write down and make sure it's accurate. Make sure it's correct. If there are test results that might have been, sometimes test results are wrong. Sometimes the data is just screwed. It's just off and they know it's a bad test result, but they still record it on your health record. That can cause you to get denied for many things just because it's an error. And oftentimes we don't catch that until we're in the process of trying to get approved for something like healthcare or not healthcare, life insurance. When we're trying to get approved for that, we find that, why didn't I get approved for life insurance? So it's very hard to talk to, there's not one plan don't fit everybody. Everybody's situation is different. Every individual is different. Just because you got denied, it does not mean you can't get approved. Let's figure out what's going on. What did that denial letter say to you? I might not know what it say, but if you have an agent that you trust to sit down and talk to, that we can look over things, it helps. I had a young lady who had a high test result. It was an error. We walked through going back to her doctor to get that corrected, and we reapplied for insurance. So I am an agent that's here for you. Each individual is different. Even if I don't have the product that can help you, I partner with other providers to make sure that if there's a product out there that you might qualify for, I don't mind referring you to someone. My goal is to make sure that I'm helping you, helping our community, and making sure that you have the right product that benefits you.
That is why we're on here tonight, to slow some of these disparities down. We're out here to help one another, support one another. We have been overwhelmed with information tonight. So we can't say after this call, after this webinar, well, they didn't tell me, I don't know. Once again, before we get off, how can we contact you?
Okay. You can contact me at 706-607-0023. I don't know if someone could put that in the chat, but 706-607-0023. Our website is www.reachmyagency.com. That's our website. We're located downtown West Point at 805 3rd Avenue. We're one door down from Carvella's Pizza. We can make an appointment as convenient to you. We have people who work. We have people say, hey, I don't get off until 5. Whatever time you need us to be there for you. We make appointments after hours. We make appointments on the weekend. But our goal is just to make sure that we are providing the service to our clients that they need. Everybody, have a different situation. So, but those are the main ways to reach me. But like I said, just give me a call, and we can set something up to talk with you about the coverages that you need.
Well, we thank you. And what I got out of this tonight from you, Kalitha, is that we need insurance. So we make sure that we can get, we need affordable insurance. We can't always choose what they say is best for us. We have to choose what's best for our finances. And also with the tax credit, make sure your tax professional understands that portion of when you're filing your return, as well as, once again, we need insurance. It's very important that we have insurance, health insurance, most definitely, so we can continue to take care of our body. That was our theme this year for Team Whip, was being the CEO of your health. And everybody knows the CEO is the Chief Executive Officer. Advocate for yourself. We appreciate you, Dr. Wilkes. We appreciate you, Kalitha, both tonight. Once again, the information has been released. If you all were not able to copy it down, as I say, as the elders would copy it down, they're on social media, the Reach Agency. Dr. Wilkes is giving her information, or just reach out to me. And I'll make sure I'll get you in contact. That is what we are here for. We're trying to bridge the gap in our communities, in the world of health. Okay. So without further ado, I hope I haven't forgotten anything. If anybody choose to, you all can follow us as well, Team Whip. We're on social media. Our website is teamwhip2015.com. If you know anybody who's been diagnosed with breast cancer, please send them our way. It's not an obligation for them to join our organization, but we just want to let them know, even after your diagnosis, there's survivorship. We want to learn to thrive beyond a color. So without further ado, Miss Marilyn Davis, she said, thanks for hosting this. You're quite welcome. A great event. And we try to have me and my webinars, if not every month, every other month. We try not to bog everybody down, because we know Monday night, some people trying to watch football. It's the beginning of the work week. You're mentally tired. But we just want to keep trying to bridge that gap in our community in the world of health. Without further ado, I hope each and every one that has joined us via Facebook Live, via Zoom, Y'all have a wonderful week. Happy holidays. Do not eat too much because we've already been told what we need to be eating. Okay? So don't be
If you
sharing your
do
plates
eat
on
too much
social
on
media.
Thanksgiving, eat
I'm
back
going
up the next day.
Okay, she said pick up the next day because I'm gonna be the police and I'm gonna be taking Dr. Wilkes. Did you see this one right here? They was eating this, okay? Because I already know some mamas be cooking them red velvets and key lime and ooh Jesus, okay, with all the icing. So I want y'all to have a great night, a great holiday. Remember, give thanks. Give thanks in all that we do. We give thanks. Kalitha, thank you so much. I hope your office floods with people. And we're gonna be coming back on because so we can give you some time. So you got a lot of information you can share with us. A lot of information.
It's a lot. It's a lot of information. Mainly, I just want to help us. I want to help us. It's a lot of information to share. So if anybody had any questions and didn't get it all, and I know we can't stay on here, just contact me. Give me a call. I'm a conversationalist. I like to talk to people. I like to get to know people. And we can talk after this. Give me a call tomorrow. I saw someone in the chat talking about insurance. It's very hard to put it in a bottle, right? Because it's so many different scenarios. But let's find the right fit for you. And so thank you, Nafanda. Thank you, Dr. Wilkes, for that information. Thank you for the platform. And thank you for what Team Wilk is doing in the community concerning our health. Health is wealth. Thank you very much. Thank you.
You're quite welcome. Thank you all so much. Everybody have a great night. I will be talking to you all soon. Love each of you.